Hello, I'm Agnes Ngassa. I am an emergency associate specialist and I work for the Hillingdon Hospital. As part of the SAS Week celebration, we've invited Dr Immad Qureshi, who's here with us today at the Royal College of Emergency Medicine.
Hello everyone, my name is Dr Immad Qureshi. I am the elected chair of EMSAS, which is the Emergency Medicine Specialty and Specialist Doctors Forum at the Royal College of Emergency Medicine, and also a Trustee Board member of RCEM. I work on the Isle of Wight in the emergency department, and I'm the clinical governance lead there. I have some other roles that I undertake. I've recently become the vice chair of the SAS Committee at the Academy of Medical Royal Colleges. I am the college's representative at the International Federation for Emergency Medicine's Core Curriculum and Education Committee, and I am the UK liaison for the American College of Emergency Physicians Ambassador Program. In addition to this, I'm a keen table tennis enthusiast, an umpire, and a classifier in para-table tennis, and I umpired at the Commonwealth Games at 2022. It's good to have you here.
So, Dr Immad Qureshi, very, very welcome to you.
Thank you, Agnes.
And thank you for taking the time from your very busy schedule to be here with us.
It's my pleasure.
So, as part of this SAS Week celebration, we've got a few questions that we'd like to ask you. So, I'll start with the first one. So, would you mind if I call you Immad?
Absolutely,
okay?
please.
Okay, sure. So, Immad, can you tell us a bit about your background and how you became the EMSAS chair of the Royal College of Emergency Medicine?
Thank you, Agnes. So, I'm Immad. I am from Kashmir in Pakistan. I was born there, and I was schooled in Saudi Arabia, and I went to the Army Medical College in Pakistan to study medicine. And throughout all this time, my ambition, at school was never to be a doctor. I was sort of pushed into becoming a doctor by my Asian parents. It's a story we've all heard. But when I did join medicine and when I was studying in medical school, I always wanted to be a pediatrician. I thought that I would be good at helping children, and that's what I wanted to do. And then when I was doing my internship, my house job in Pakistan, I really enjoyed every minute I spent in the emergency department when I was there covering the on-calls for other specialties, whether it was medicine, orthopedics, general surgery. But Pakistan didn't have emergency medicine as a specialty. Anyways, I went back to Saudi Arabia to be with my parents, and over there, the first job I found was as a resident in emergency medicine. And the first day I went to work there were quite a lot of senior people who were trying to induct me into the department. And on that day, the patient that's going to stay with me forever, there was a gentleman in his 80s who'd come in with a diarrheal illness. And he was given a bolus of fluids, and he perked up and he wanted to leave. But the doctors there said, you're going to go back, you're going to continue to have diarrhea, you'll be back with us soon. We want to give you some more fluid. And they gave him another liter of saline, and he went into cardiac arrest. We managed the cardiac arrest. I took charge of the airway, intubated him, he got admitted to ICU. And at some point during all of that, I realized that this is what I wanted to do for the rest of my life. I wanted to help people on the worst days of their lives.
Oh, that's very interesting. Yeah, really.
The second part of your question about how I came to be EMSAS chair. I was working as a Caesar specialty doctor for Heart of England NHS Trust in Birmingham at Heartlands Hospital. And while I was working there, I was progressing through my exams and my rotations, and an opportunity came up to be the SAS representative on the regional board. And I applied for it. It was a competitive process with 3 days of interviews, and I was successful. So I got to join the regional board for West Midlands. After that, I started to get engaged in FastGem. I became the SAS representative on the education committee here at RCEM, and slowly worked my way up. And when the last chair, Steve Black, was about to end his term, there were expressions of interest asked for people who wanted to be chair. And our vice chair, Jocelyn, who's still our vice chair, she was keen to apply for the role, as was I. And I thought if we both applied, there will be some interest generated, there will be some media hype, there will be an election, so it will be good for SAS doctors to bring them out there and people to be engaged. And we went for the elections, and I was surprised when I won.
Oh, that's great. So what does your role entail as a chair?
So as EMSAS chair, I am your representative for all SAS doctors who are working in emergency medicine at the Royal College. I bring our issues to the college. I try and ensure that the college hears our voice, and if there's any policy changes or any recommendations coming out from the college, they've considered the SAS perspective.
Okay, that's quite interesting. So clearly, you know, SAS doctors, they constitute a big part of the emergency medicine. So how do you see their work? How can you explain how crucial the SAS doctor work is?
I think SAS doctors in any field in the NHS are crucial to the functioning of the NHS. We are the permanent workforce in a lot of departments. We are substantive members of staff who stand side by side with our consultant colleagues. And as we get more senior and require less supervision, some of us are taking on independent, non-supervised roles, working with our own clinics, with our own patients, doing our own lists in theatres as anaesthetists and surgeons. But in emergency medicine, it's the ability to work independently and supervise others, and also contribute to the on-call rota and the consultant rota for the more senior ones and the ones who've demonstrated that competence and qualification. Mm-hmm. So I think SAS doctors are very, very essential to the functioning of any department, especially an emergency department.
Okay. So, like you just mentioned, we know that SAS, the SAS doctors, especially in emergency medicine, they constitute a big chunk of the workforce. But is there any, what are the pressing challenges that SAS doctors are facing in emergency medicine?
I think that's a difficult question to answer, because it's very region and sometimes organization specific, these challenges. But what I do see is that a lot of SAS doctors are asking for support. They're asking for opportunities to show that they have leadership skills, they have educational and teaching skills, that they have skills that they can really contribute to the workforce. But these are often not afforded to them because of a cultural mindset that consultants are more trained in leadership or more trained in education, where that may not be the case. Mm-hmm. And similarly, if roles start being given to SAS doctors, it eats up their PAs, and they're not available to do the service provision and the clinical work. So I think the biggest challenge for me when I speak to other SAS doctors that I hear is that the majority of their contracted hours are focused at service provision and not at career progression, or even just progression as leaders, as educators, or opportunities to do outside interests.
In your view, what has been the impact of EMSAS group within the Royal College of Emergency Medicine?
It's a good question, and if I just start with the history, so we started as the Forum for Associate Specialist Staff Grades and Specialty Doctors in Emergency Medicine. That was, the initial name was FASGEM, right. Founded in 1997. And since then, it's had a significant impact. To the point where we started to gain recognition within the specialty and by our colleagues. Perhaps the biggest impact of FASGEM has been moving away from that nomenclature of non-trainee, non-consultant grade doctors, and people knowing what SAS stands for. And as the definition has evolved from NHS employers, also understanding that the grades have evolved as well. Mm-hmm. So I think that's probably one of the biggest impacts we've had. In addition to that, we've been running an annual conference since our inception, which is, again had been very well received. And the reason that it came out was that the RCEM annual conference at the time was often attended by consultants, and SAS doctors were left in the departments to provide service while the consultants were away. And there was a need for a conference focused at the needs of SAS doctors that allowed them an opportunity to book in bulk while consultant and resident colleagues or trainee colleagues covered the department.
Okay. So are there any opportunities available for SAS doctors in terms of professional development or career advancement within the Royal College of Emergency Medicine?
Definitely, I'd say within the Royal College of Emergency Medicine, we now have a voice on every committee and subcommittee at the college. So the SAS voice is not just my voice, it's not just my opinions. We have more representatives and more execs than ever before since FASTGEM was incepted. To now the rebrand to EMSAS, which is the Emergency Medicine Specialty and Specialist Doctors Forum. But we are represented on College Council through me. As a Trustee Board member, I help the college shape the direction for the whole specialty, not just for SAS doctors, but it also ensures that there is somebody who is an advocate for SAS doctors at that level. The college has had SAS grade examiners for a long time, but they've revised their eligibility criteria, and now there are more SAS examiners at the college than ever before. So there are multiple opportunities at the college. Also, when the college looks for either Trustee Board members or members on council from the general membership, they can be either members or fellows of the college, and they don't necessarily have to be consultants. So again, there is that opportunity at the college for people to get involved.